Hey everyone, welcome back to Straight Talk with Dr. Erik. And on today's episode, we have an incredible guest. Now, I just want to paint the picture. I'm not sure if my guest is going to like the way I paint it, but in basketball, we have a GOAT. That's called the greatest of all time. To me, that's Michael Jordan. Music, you have the Beatles, you have Elvis Presley. When it comes to cognitive neurology, and it's not just my personal view, but this is what a lot of folks agree with. The GOAT, the greatest of all time, is Dr. Jim Galvin. And it's a blessing and an honor to have you today on the show. Welcome.
Well, thank you, Dr. Erik. I really appreciate those very nice, kind words. I don't really think of myself as a GOAT, but sure, I'll take that a compliment.
It's the truth. It is the truth. And I have to tell you, Dr. Galvin, there's one of our videos, we get a lot of viewers, and one of our videos lately got 40,000 views. And the folks who listen to us are caregivers, are persons living with dementia, are people who are interested in learning more about cognitive health. So the first thing I want to say is, Dr. Galvin, I do want to mention some of your accomplishments because very often people say, well, why did you say he's such a great wife? Who's sitting here? Who's giving me advice? And it's very important for me to go into that. So, number one, you are a professor of neurology and psychiatry and behavioral sciences at the University of Miami Miller School of Medicine. Number one. Number two, leadership. From a leadership perspective, Dr. Galvin is the division chief of cognitive neurology, and you're the founding director of the Comprehensive Center for Brain Health. I visited there myself. I met your team, Carrie Greenfield, who's your nurse practitioner. Incredible, incredible work that you're doing there. And to know that you are the founding director, that's a legacy that will continue after 120 years, long after we are gone from this earth. And that's incredible.
From your lips.
God willing.
Yeah.
From a research perspective, so just painting the picture of who you folks have today listening to and giving you guidance, not medical advice, but guidance, right, from his experience. From a research leadership perspective, director and principal investigator of the Lewy Body Dementia Research Center of Excellence. From a scholarship perspective, Dr. Galvin is an author of more than 450 scientific publications, 3 textbooks on brain aging, Alzheimer's disease, and Lewy body dementia. And here's something very, very important. Dr. Galvin is a principal investigator on 9 active NIH grants with over, and I'll feel like the lotto man, $150 million of research funding. Now, it's easy to say, but it's not easy to actually accomplish that much funding. To do what? To fund research for folks who are listening right now that affects their family. So welcome.
Thank you.
Incredible to have you. One of the things I want to start off with is not the medical perspective, not the cognitive perspective, but tell the audience about you. What made you get interested into thinking about cognitive and brain health and becoming a neurologist and spearheading, and like I said, in my mind, becoming the GOAT in this area, the greatest of all time?
Yeah, I think like a lot of people, you have a personal interest. So I always wanted to be a doctor as far back as I could remember. I think at age 5, I wanted to be a cowboy.
Oh, nice.
At age 6, I wanted to be an astronaut. But from age 7 on, my mom kept one of those little books where they write what you want to be. I wanted to be a doctor. And I always found sort of the brain really interesting. And then you have your own personal experience. So I grew up in a 2-family house in New Jersey. My grandparents lived upstairs, and we lived on the first floors, very close to my grandparents. And my grandfather worked for Colgate-Palmolive. And so he, back in Jersey City, New Jersey, so that's when the factory was still there, and he was a greaser, so his responsibility was keeping all the machinery working, climb up and down ladders and, in all little passages and keeping things going. And I did a lot of things with my grandfather, and so I was on the swim team in high school, and he used to pick me up because I went to high school in Jersey City, and he picked me up and drove me home. And one day we were driving down Kennedy Boulevard, which in Hudson County, New Jersey, is very similar to Broward Boulevard, right? So big, busy street. And he made the world's slowest left-hand turn. And we got broadsided by another car.
Wow.
And luckily no one was hurt, but I was 16 at the time, and I remember turning to him and saying, like, what happened? because I knew something was wrong, right? And he said, "Oh, I don't know, the car didn't handle right." I'm 16, I didn't think much of it. Anyway, so he was working at Colgate-Palmolive, and he fell off a ladder, and was in the emergency room. Had a couple of broken ribs, and my grandmother went to go pick him up, and the ER doctor turned to my grandmother and said, "How long has Ed had?" My grandfather's name was Edward. "How long has Ed had Parkinson's disease?" And she's like, "What are you talking about?" And he goes, "Well, look at his hand." And he was doing this with his fingers. And again, I didn't know any better at the time. And so I got to watch this, vibrant, lively person that I, grew up with, start with motor Parkinson's, become slower, stiffer, and then started developing cognitive problems, becoming more forgetful, and then started having some of the behavioral problems, developed visual hallucinations. And so when I was a medical student, so like my first or second year of medical school, I remember, going home and visiting them. And my grandfather started asking me questions about, was I going to apply to medical school? And I'm like, I already applied to medical. I'm in medical school. And he just couldn't get me past sort of college. And then from that point on, like every time I saw him, he just kept placing me back, getting ready to apply for medical schools, and just lost all that time. And so I was married, I had children, and, again, he recognized those people as people he should know as familiar, but didn't know who they were, and kept placing me back in college. And then one day, it was a Sunday afternoon, and my father and my grandfather were watching football. And at this point, my grandfather was almost totally immobile in a chair, and jumped out of the chair because he had hallucinated, fell down, broke his hip. And then had a hip replacement, and then died about a week later in the rehab hospital. And I remember my grandmother saying to me, at this point I was, finishing my neurology residency. My grandmother said to me, "Jimmy," she calls me Jimmy, she said, "Jimmy, you have to do something about this." And I promised her I would.
Wow.
And so from that point, my career has largely focused on trying to improve early diagnosis and develop treatments that will be more effective.
Wow. Wow. And the more I read and the more I evaluate life, I'm 44 years old, and I look at people who are truly successful in their careers, it's those people who do have a personal mission when it comes to what they're trying to solve, the problem they're trying to solve. And again, the reason I see that you have become so well known and so impactful. Well known is one thing, that's marketing, right? But talking about impactful in the lives of people is because I'm sure you take it back to Grandpa. I'm sure you're saying, well, how can I, Jimmy, have an opportunity to extend the interaction of other Jimmys with their grandfathers, because I can solve this problem called Parkinson's disease or Lewy body or Alzheimer's.
Yeah, no, I think that's true. I mean, I think if you think about the things that kind of motivated you, that stimulated you to do things, there are often experiences in your life. And I look at each individual as an individual. So if I've seen one patient, I've seen one patient.
Right.
And everybody has their own story to tell, and their story is important. And I think as a medical professional, it's my job to listen to that story.
Beautiful. Speaking about caregivers, speaking about listening to stories, the folks who are listening today, I'm sure they are very interested in learning about this disease. And we're going to hit a couple of important topics. The first topic is this. We'll start very simple. Families hear the word dementia, and then they're like, oh, it's Alzheimer's. What's the difference? Is it Alzheimer's? Is it dementia? What's the difference between the two? And why is it important to actually know the different dementias that are out there and what you actually have? Is there a difference from a clinical perspective, from a treatment perspective? Or is it just, oh, I have dementia, that's it, that's what the doctor said?
Right. That's a great question. So the first thing to take away from this is dementia is really a general term.